Always find joy in the smallest of things. That is what we found in you. Oh, 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 you are joy. Never give up when the going gets rough. Hope is everything you need. Oh.
I'm Renae Vania-Tomczak, President and CEO of Mental Health America of Greater Houston. I have worked in the mental health industry for about 10 years, and as most people who work in mental health have very personal reasons for this. Family members who have experienced mental health concerns, and I'm proud to be a part of the solution and getting resources to those who need the resources. At Mental Health America of Greater Houston, our work is driven by providing community solutions to promote mental health for all. Much of our work is as a convener of partners to shift conditions that hold problems in place. The work of Mental Health America is rooted in the philosophy of before stage 4. What that means is when someone is diagnosed with cancer or heart disease, we immediately take action to treat those symptoms to reduce the progression of these diseases. Like other diseases that I've mentioned, it is critical we do the same with behavioral and mental health concerns to put people on a path to overall wellness. In addition to our overarching work in education and advocacy, we work collaboratively in 3 primary areas. With treatment courts to serve justice-involved veterans so they can return to home and to health. With physical and mental health entities, we work to integrate care to serve the whole person. And our Center for School Behavioral Health is working with administrators, teachers, counselors, and other student-facing people to recognize behavioral health concerns. We then provide technical assistance and training to support the well-being of all students. While our general geography is the Greater Houston area, we have taken our expertise in dealing with the mental health impact of natural disasters, particularly those on children, to serve the communities of Puerto Rico, Florida, and the Virgin Islands. I encourage everyone who may be concerned about their own mental health to take a mental health screening through our website at mhahouston.org. It's the easiest way to begin what many see as a difficult process to share that you have a concern with others. It's free and confidential, and you can print it to start the conversation with a loved one or a doctor.
Hi, my name is Dr. Raymond Cho, and I'm a professor of psychiatry at the Baylor College of Medicine and also president and medical director of Houston Mind and Brain. We focus on things such as depression, OCD, cognitive impairments, and other serious mental illnesses that cause some significant impact on people's lives. Some non-medication therapies are available in the form of brain stimulation. So instead of taking a pill every day, one can receive stimulation in various forms in a non-invasive way. So there's nothing probing the brain physically, but these therapies can be highly effective. And one of those therapies is called transcranial magnetic stimulation. So that's a mouthful. So people call it just TMS for short, transcranial magnetic stimulation, TMS. And that refers to a form of therapeutic for the brain that involves magnetic fields that are applied transcranially. That means through your scalp and skull and directed at various brain targets. And what's remarkable is that this therapy can be extremely helpful for things such as depression and OCD, and even more recently, it's been found to be effective for things like stopping smoking habits. And all these three indications that I just mentioned, depression, OCD, and smoking cessation, have actually been approved by the FDA. So just like the FDA thoroughly reviews and approves new medications, the FDA is also a body that reviews device-related therapeutics, including TMS. So this therapy has been actually around for quite some time, and I think it's a very unfortunate tragedy that so many people don't even know about this really effective therapy. Of course, everybody knows about medications, and just to give an example, with depression, many depressed patients have gone through multiple medications, sometimes having to be hospitalized, sometimes with very severe life circumstances, such as considering or attempting suicide. But all they've been tried on is a series of medications that, either due to inefficacy, not being effective for the depressive episode, or not being able to tolerate the medication due to a number of different side effects, there's a loss of hope at the end of that road because of this ignorance of other alternatives, such as TMS. This is what the TMS device actually looks like. So depending on what specific type of device manufacturer, it may look a little bit different, but this particular device is made by BrainsWay, and the patient sits in this comfortable chair, and these different helmets, one is blue, one is yellow, have different purposes, although they look very similar except for the color. The blue one, within the helmet, there's a coil that the way it's configured will target the left dorsolateral prefrontal cortex. That's a front left part of the brain, and that's a very critical site to target for the treatment of depression. The yellow helmet, on the other hand, is a quote OCD helmet, because the coils within this helmet target it's still the front part of the brain, but more in the midline section, and that brain area is very critical for the treatment of depression. So as you can see, there's a little head strap here. The patient will put on the helmet, and we strap them in so that it fits snugly. Magnetic fields are what's actually administered is fairly strong, but they also weaken very quickly. So unless the helmet is on fairly snugly, the patient may not be getting the full therapeutic effect of the magnetic pulses. So the basic procedure involves putting on the helmet. The first session will determine exactly where that helmet should be and how strongly the stimulation should be for that particular person. And then they sit in this chair wearing the helmet, and typical treatment lasts about 20 minutes.
Hi, my name is Rachel Eddins, and I'm the Executive Director and a licensed professional counselor with Eddins Counseling Group in Houston, Texas. At our center, we serve anywhere from children to adults ages 3 and above. We work with teens, we work with young adults, we work with families, couples, and adults struggling with a wide variety of mental health related concerns, career concerns, or just life transitions. Today I want to talk with you a little bit about DBT. And DBT is a type of therapy, and I want to explain a little bit more about how it works and who it is a good fit for. DBT is one of the types of therapy that we offer here at our center at Eddins Counseling Group. So DBT, it stands for dialectical behavioral therapy. Those are big words, but in the nutshell, DBT was really developed to help people cope with overwhelming emotions. We've all experienced overwhelming emotions at some point in our life, but when that happens on a more regular basis, it can become very difficult to live with. And we may develop behaviors or ways of coping with those overwhelming emotions that are no longer helpful or what we call adaptive for our life. That's where DBT comes into play. DBT is about teaching us new skills to cope with those overwhelming emotions so that they become more manageable. I like to think of it as emotions as waves. We experience emotions in our body, and they are very much like waves. They come and go. So if you can imagine that you're in a boat and very strong waves are crashing against your boat, you can't really just stop the waves, right? So we can't really just stop our emotions from happening. And when we do try to stop them or make them go away, it actually makes them worse. Instead, what we want to learn how to do is be the captain of that ship. To learn how to navigate those strong waves, that storm, the heavy seas, or whatever you want to think about that as, to be able to navigate that with effective skills and strategies to get through to the other side. Because one thing we know about waves is they come and they go. So if the time that we're experiencing right now is intense, that intensity will go. It will change. What we have to do is learn how to hold on in the meantime with the various skills that we have so that it doesn't get worse, so to speak, right? So I'll talk a little bit more about that in a second. For everybody, it's different. And that's the important thing, is that regardless of where it comes from, the perspective is that we're here in the present moment right now, and it's important that we learn skills and find ways to solve the problem of what we're experiencing right now. So DBT is very much focused on skills development. You're going to learn practical strategies to cope with difficult thoughts, difficult feelings, regardless of where they come from. So the focus is on skills building, problem solving, and not judgment or blame or going back into the past. We're really focusing on the present moment. So in terms of what might cause some of these symptoms that we experience with difficult thoughts or feelings, that's, for some people, it's just genetic. You might have felt that you were just born that way, that you were a little bit different, and maybe found yourself crying in movies when others weren't, or feeling kind of like at the edge of your skin, almost like you were, or maybe riding on a roller coaster, maybe feeling like your life is a roller coaster, that things are just experienced more intensely than your friends or your family members. So the point is that it's not your fault, and you're doing the best you can with what you have. That's a really important philosophy that is part of DBT. And you can also learn to change and build skills to cope differently.
Hi, I'm Lisa Sullivan. I'm Executive Director of the Texas Suicide Prevention Collaborative, and we really appreciate the opportunity to visit with you today about our important work. The Texas Suicide Prevention Collaborative, our piece of this puzzle is to help ensure that the communities in Texas have the resources they need to create a suicide-safer environment for their community members. And this started back in 2001 with the Governor's Trauma Advisory Council, who brought together a team to respond to the U.S. Surgeon General's call for action for suicide prevention. This created that public-private partnership that is so critical in effective public health suicide prevention. And through the years, this council has grown into a 501c3 dedicated to this purpose. A couple of things that are really important to realize is just kind of how this helps Texas communities. And I know we're a big energy state, and so I think of it as a pipeline. The collaborative's role is to serve as that pipeline that connects not only to national and state and international resources throughout our local communities, but then also connect those local communities together. By having that pipeline to distribute effective and evidence-based suicide prevention practices and programs and resources, we're able to get that information into the hands of local communities much faster by having this kind of clearinghouse approach and the technical assistance that goes on to support that. One of the questions I sometimes get is, why are communities so important to the conversation around suicide prevention? Why aren't we just talking about healthcare systems or crisis lines? And the answer to that is a couple-fold. One is, Texans live in communities. This is the place where we can intercept most people who might be at risk. Crisis lines just aren't enough to serve in that capacity to reach individuals that may be struggling with a mental health condition or suicide. Communities and everyone that's part of a community, whether that's a school, law enforcement, librarians, barbers, hair salons, we all have a role to play in that. So that community fabric, that tapestry that is woven by the interaction of these pieces of our community is essential to moving suicide prevention forward. This includes equipping each community member, regardless of what role that they are playing, to be able to respond and identify someone at risk and connect them to care. And then work beyond that depending on your role in your community member. So one of the things that I think about this is CPR. So let's talk about this for just a minute. If you were to have a heart attack, which city would be the most likely to survive you would be most likely to survive a heart attack? Is it Houston or Dallas or Miami or Los Angeles? The answer to that question is Seattle. And the reason why is Seattle has the most residents per capita that have been trained in CPR than any other city in the country. The time you are most likely to die from a heart attack is before you get to the hospital. So think of suicide prevention in the same way. The better equipped our communities are by everyone looking out for their neighbors and their family and their friends, and they know the warning signs and they know the risk factors and they know how to connect to care, this is where this community element becomes so vitally important. So that kind of brings us to why the pipeline is so essential. And when you look at the work that's happening at the national, the state, and the international level, all of that good work isn't going to make a difference if we cannot get it into the hands of our local communities to be able to implement that properly. So we want to be sure that we have that capability to drive those evidence-based practices deeper and farther across our state so that we can be sure to have our communities as equipped as possible for suicide prevention. And this is where the Texas Suicide Prevention Collaborative comes in. We work together with our stakeholders through a network of 35 local coalitions, nearly 40 statewide partners, 25 military veteran community members, member organizations, and 10 or 11 higher education institutions that all come together. And what I'd like to say is we get everybody in the boat rowing in the same direction, moving our state forward to becoming a suicide-safer state. So having these partners all working efficiently and effectively, and most importantly, collectively and collaboratively across our state is going to give us better outcomes over time than everybody going it alone in their own direction, in their own way. So this is one of the ways that we're able to contribute to a suicide-safer Texas. So our 4 or 5 main areas that we focus on is we really try to catalyze the use of those evidence-based practices, being sure that community partners are aware of and have access to things that are research-based, tools and resources and trainings that are research-based for effectiveness and safety in the construct of suicide prevention. We implement learning communities, and this is where we bring all these local coalitions together so that we can learn from each other and to help lift everyone as we work together. We mobilized Texans across the state for this implementation and for practical and achievable solutions to work in our communities across Texas. Because we realize one size doesn't fit all. Communities have to prioritize what their particular community needs are and work within the resource constraints that their organization or their community may have as they work forward. We know, for example, from our data, from our local coalitions, about 40% of our local coalitions are utilizing the Texas State Plan for Suicide Prevention and designing their implementation plans. But we also know only 19% are using the CDC's technical package that's designed specifically for communities. So our job is to help them get access to that and learn how to apply that for their local communities. In fact, 3 out of 4 organizations that responded to our survey were either did not know about it at all or were only slightly familiar with this vital resource. So we really want to be sure, and this is where the pipeline becomes so critically important. It's a way to drive resources, proactively reach out to our local communities, and to be sure that the information is getting where it can be of most value and have the most benefit. So some of the things that we work on are examples of the work that we provide for our local coalitions and statewide partners are an easy-to-use toolkit. This is one of the questions that we get all the time is for how to work. How do we do something? How do we design a prevention program? How do we design postvention? How do we design an intervention strategies? So we develop easy-to-use toolkits so that communities can walk themselves through this process of designing their systems. Another piece that we really play a strong role in Texas is training. So we think about training the way nutritionists think about food. Fresh is better than frozen is better than canned. We look at training in that same lens. In-person training is highly effective and supportive. We know about 1 in 3 attendees who come to our trainings have some form of lived experience. So that in-person training is so important for creating that connectivity and that spirit of collaboration as we all work together to build that community framework. If that's not available, online training is also a great resource. Online training for us, we have trained nearly 60,000 Texans in suicide prevention gatekeeper skills. The most prominent audience for that are K-12 educators. We provide this training for free, and we're very excited to be able to offer that throughout our state. And both of those options are much better than going it alone or trying to figure it out by yourself. So we really strive to provide training solutions that make sense for local communities and community partners. We also serve as a resource hub for the state. At texassuicideprevention.org, we have resources for local coalitions and for statewide partners. We provide resources and fact sheets and public service announcement videos, training documents, statute review. All of that work is done and centralized at texassuicideprevention.org. So please reach out there if you have some time. Another piece of our puzzle is outreach and communications. So one of the things that we really strive for here is to help reduce stigma. This is one of the highest priorities for local coalition. How do we reduce stigma relative to suicide prevention so that Texans aren't reluctant to reach out for help? And then finally, we work with these learning collaboratives. We sponsor monthly meetings to bring all of our local coalitions together to learn collectively from timely topics that we work to move forward. So how can you help? First, support your local coalition. 75% of local coalitions do not receive any funding. This means they are bootstrapping their way to evidence-based processes and practices to help make their community suicide safer. Donate, volunteer your time, engage in your local suicide prevention coalition so that community collective effort can be more efficient and more effective, and to help local community members that may be struggling with a mental health condition get the services and support services they need. Another way to help is to support the Texas Suicide Prevention Collaborative through either donating or volunteering with our organization. It helps us to reach more Texas communities, to build new coalitions across the state where we might not have a presence yet, and to work towards helping to ensure suicide prevention reaches every Texan where they are in their local community. And finally, I would just like to close with just an analogy that I hold in my mind when I think about suicide prevention. I'm wearing a brooch today that is a mosaic. And that, to me, that symbolizes a lot of different things that correlates to suicide prevention. First, mosaics are composed of a lot of small pieces that come together to create something beautiful. What we're trying to do here is to bring all those pieces of a community together to be sure that we're able to create that one image of a suicide-safer community that keeps everyone in that community safer. Jody Crone is the artist that makes this brooch, and her group is called Broken But Beautiful. Beauty can come from all of these pieces working together, and that's what we would like to see happen across Texas.
I'm Dr. Michelle Patriquin. I'm the Director of Research at the Menninger Clinic. I'm also a senior psychologist here at the Menninger Clinic, and I'm board certified in child and adolescent psychology. So one of kind of the most hidden signs that we may be struggling with depression, anxiety, can even lead to things like substance use or even thoughts of taking your own life, is our sleep. Sleep can be kind of a hidden sign, and if you're having trouble sleeping, falling asleep, maybe you're up late at night and you are worrying about the next day a lot, or you wake up in the middle of the night. So either you can't fall asleep, or you're waking up in the middle of the night, and then you can't fall back to sleep. Then some of those sleep disturbances can be really related and a really strong hidden factor of and related to difficulties in our emotion and behavior. So when we have some of these sleep problems, it can be a sign that we may be having other emotional and sometimes behavioral issues too. We can be having a really hard time focusing in school. And it's interesting because it's actually a bidirectional effect. So sometimes we have sleep problems, and then that's related to increases in more problems with our attention, more worry and fears, more feelings of like sadness and loneliness. And then that actually creates more sleep problems. Or we have the reverse. So we have some emotional and behavior issues that start to really disrupt our sleep. It can be really hard to understand how you feel. And sleep is a really kind of concrete, clear way to understand when you might be having difficulties. And it may be time to ask for some help. And really, this is a good sign for when to ask for help from a professional, or even just your parent and relaying that information to them, talking with a good friend. But that can be a very clear sign that something's not going right. And there's a lot of resources out there to actually help with your sleep. And a lot of resources, treatment, cognitive behavioral therapy for insomnia, and evidence-based treatment that can really help you improve your sleep. And that will, a lot of times, even just improving someone's sleep alone can improve their thoughts of suicide or taking one's life, thoughts of depression and loneliness, and improve someone's worry too. Just changing your sleep alone. So it's a really powerful tool, not only in understanding how you might feel, but also a very powerful way to change how you feel too. So mental health and mental illness and symptoms of mental health have both a environmental component as well as a biological component. And there are certain biological precursors, predictors of mental health that can include the way our brain functions. So the way certain brain areas work and are connected to other brain areas, as well as even our genetics play a role in mental health and the onset of any mental illness or symptoms. But those things, those biological responses, and even the way that we are built biologically will interact with things in our environment. So if we have something traumatic that happens to us, that can really, when you have a certain kind of functions in your brain or certain genetic profile, when that interacts with a certain stressor, like a trauma, or even challenges, interpersonal challenges, or maybe parent-child conflict, that can result bullying, that can result in, increases in worry and depression. But we really think of mental health, mental illness as having both biological factors as well as environmental, and your own personality, and the way your personality kind of structure, what it looks like. Are you more introverted? Are you more extroverted? And the social support that you have as well.
Hello, my name is Dr. Cory Walker. I work at the Menninger Clinic in Houston, Texas. I'm board certified in psychiatry and I'm board certified in internal medicine. Basically, that means I'm your general doctor for adults, as well as looking at mental health as well. So can take care of the whole body and mind. At Menninger, I work at a program called the Comprehensive Psychiatric Assessment and Stabilization Unit. On that unit, we help people who have usually had multiple attempts at treatment and just seem to be struggling to get the right diagnosis and the right treatment regimen. We look at the comprehensive 360-degree view of a person. We look at you medically, we look at you psychiatrically, we look at you psychologically. If cognition's an issue, we look at that. We also look at your social surround and what is the context in which you live. And we figure out what is holding you up. Because one of the things I've learned from doing this is that it's never a failure of effort. It's not a failure of intelligence. It's not laziness. And typically I find also that people are not broken. They've been hurt and they need to heal. And what we work on doing is taking their very adequate efforts and figuring out simply how to redirect them so they start getting the outcomes they want. In addition, at the Menninger Clinic, we have both inpatient and outpatient services. Included in the inpatient service is the Comprehensive Psychiatric Assessment and Stabilization Unit, which I just discussed. But we also have a unit for people who have been dealing with mental illness for a period of time, and they can go through a treatment program that's very intensive, and I have the benefit of being in a group. Having people in a group who are struggling with the same issues can be very powerful and definitely aids healing, especially one of the things that we lose when we start to become ill is our social connections. And so it gives you practice to rebuild. We have another unit that specializes in professionals. Every so often, professionals have a stumble, something happens, their mood gets bad, there's substance issues, there's family issues, there's losses, and it can trip someone up in the middle of their career. And having someone in the group, having a group of people who are struggling in the same way with the same thing, can be so supportive and helpful, as well as having a recognition that there is a need to continue working while you're trying to get treatment. We have an emerging adults unit that helps people working with substance abuse issues, family discord, difficulty taking up their independent lives, and personality disorders. We also have an adolescent unit that treats children 12 and up. In outpatient services, we have your traditional outpatient care, such as psychiatric services for medical management, we have therapy, but in addition, we also have groups, we have family therapy, we also have different series that are specialized, that are offered at different times during the year. We also have a new Menninger Moms program for dealing specifically with women who have young children and the challenges and joys that brings. And what we're really working on here at Menninger is trying to be innovative, advance, and serve our community to the best of our ability. Innovation is so important. And one thing I would say is that we welcome suggestions from the community. Should you have a suggestion, something that you wish you had on offer from mental health services, let us know. If we can make it happen, we will. We definitely want to be an asset to other professionals in the community, as well as to our community at large. Menninger is located in the southwest of Houston. It is on a 50-acre campus. It's actually a beautiful campus. The inpatient setting is luxurious. It's individual rooms. We have a professional chef, which can be a mixed blessing. The food is quite good. When you are in the treatment units, you will also get individual therapy. You also get 40 to 50 hours of group a week. And if you think about that, meeting with a therapist once a week, that's about a year of therapy. So you can really get a lot done. We are here to provide support to you and your families, and we want to support your goals so that you can go forward and have a fulfilling life.